Hi everyone. Today I'm going to be going over my top 5 exercises that I like to prescribe to my patients for relearning how to integrate our deep core system with our breathing as well as our pelvic floor connection. So our central stability team that allows our torso and our pelvis to stay stacked and strong throughout our day-to-day activities requires coordination between our breathing muscle, our diaphragm, our pelvic floor at the bottom of our pelvis, our transverse abdominis, which wraps horizontally around our torso, as well as our deep back muscles, the multifidi, that are integrated within each segment of our spine. So these 4 team players work together to create what we call intra-abdominal pressure that allows our body to be stable through our trunk system while we're moving about our day. So before we can proceed and move into more challenging exercises, we need to have a good coordination system between those 4 players in order to optimize efficiency with our movements. So I'm going to go over how to utilize this and how to practice our breath with our deep core connection and our Kegel in this particular video. So if you have access to a resistance band, go ahead and grab it. I find it to be helpful with feedback. If you don't have a band, feel free, you can use your hands in the exact same location that you'll see me using the band. But if you have one of these handy, I like it a lot for feedback. So I'm going to take my band and I'm going to wrap it around the lower part of my rib cage, kind of around sort of the area for us ladies where your bra usually kind of sits. And I'm going to wrap it around a little bit, and then I'm going to lie on my back here on the mat with my knees bent and my body just relaxed in this position. So you're going to take your band, and I want you just to create a little bit of light tension out to each side so that you can sort of feel that resistance band hug around your rib cage. This is important because we're going to be working on optimizing our breathing and really working on what we call lateral expansion of our rib cage, that movement of it kind of moving east and west, but also thinking about breathing into the back part of our rib cage, which is often where many of us tend to forget to breathe into. So with this particular movement, the band is going to give us that feedback to really reach and kind of press our rib cage out into it with our inhale. And then as we exhale, that rib cage is going to recoil back towards the spine, and you're going to feel that resistance band kind of slacken in tension. So let's practice that now. So we're going to take that little bit of tension on the band. My elbows are grounded down into the mat. We're going to inhale, filling my ribs, and then exhale, letting that go. So again, as we inhale, we're increasing that resistance and pressing out into the band 360 degrees around. And then as we exhale, that recoil is happening and it's releasing that tension on the band as feedback, okay? So now integrating that breath with the rest of the system. So in a previous video, I explained how our Kegel and our pelvic floor connection is facilitated with our breath. So as we inhale, that pelvic floor is supposed to relax and to lengthen. And as we exhale, that connection around our pelvic floor is supposed to contract and draw up and in while we let our air out. So we want to be thinking of that coordination system and practicing that now with our breath. And in that exhale phase, that's also where our deep core system is going to connect. So those low abdominals, the middle abdominals, and our upper abdominal teams are going to also be integrated into the system during our exhale phase. So we'll take an inhale, we'll breathe out into that band, we'll relax our pelvic floor, and then exhale, start from the bottom and work your way up in terms of connecting the Kegel, the low abdominals, middle, and upper all in one simultaneous kind of sweep, and then drawing the upper ribs towards midline in order to connect the entire thing. So let's practice that here together. So you'll take your band, you're going to create that little bit of tension, elbows grounded, you're going to inhale, expand your rib cage into the band, relax the pelvic floor, and then exhale, start to connect that Kegel, draw up and in, lower abdominals, middle, and upper throughout the exhale, and then repeat. So inhale, relax everything, expand the rib cage, exhale, connect from the bottom up, Kegel, lower abdominals, middle, and upper, and continue that breath cycle throughout. So a couple things to keep in mind. As we're inhaling and exhaling, we want to make sure that the space where my pelvis is sitting and my rib cage is sitting does not change. So often as people take an inhale, they may want to arch and not even notice it, but that's a common compensatory pattern. As we exhale, another common one is that we kind of flatten our back and round and really scoop and kind of tuck under our pelvis. In doing so, we're now changing that intra-abdominal pressure and making the system less efficient. So I want to try to maintain that neutral alignment where my pelvis is sitting here parallel to the mat underneath me. My rib cage is just grounded in that exact same orientation. I have just a little bit of my natural curve of my spine here so that I can slide my fingers under, but it's not an excessive arch, and I'm not squishing my fingers if I were to place my hand there. So while we practice this, in the beginning this may look like a very simple exercise, but for people that have pelvic pain or issues with their pelvic floor, challenges with connecting their core, or low back pain, this is often a system that is struggling to coordinate properly. So practicing this is really important, as well as to then take this whole breathing strategy and deep core strategy into your other exercises to make your movement more efficient. So I recommend people start with this exercise, start to practice it every few days to get used to it until it starts to become more natural and subconscious. And then this is also what you want to lay over into your other exercises. So set a timer, 2 to 3 minutes, just lying on your back, working on your breathing. And over time, I promise this will start to become easier and you'll start to notice a really big difference in terms of your breathing efficiency, your deep core efficiency, and how your pelvic floor starts to become part of that really important system. So give it a try, see how it goes.